Welcome to the Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter at FoleyTom, and the hashtag The Virtual Shift. We have a great guest on from the law firm of Foley, Laudner, Aaron Maguregui, digital health attorney. Aaron, welcome to the program.
Hey, Tom. Thanks for having me.
So, Aaron, your focus is on the security side of the equation relative to healthcare. And there's been really some interesting developments in how the FTC and the HHS and other government entities look at what is PHI, and therefore what is compliant with HIPAA and what's not, as we look at this market transformation. So can you tell us a little bit more about, one, what you do, and two, a little bit more about this new development here?
Yeah, so I am a healthcare lawyer by trade. I focus in privacy, security, and really what has become healthcare advertising. And I represent digital health companies, both direct to consumer, cash pay, also digital health companies looking to get into third-party reimbursement from health plans, Medicare, Medicaid. And really my focus over the last couple of years while I've been in private practice back at Foley has been sort of the intersection of privacy and e-commerce, right? It's this thought that we have these great tools and some of these great companies out there that have made healthcare accessible and easier to obtain. But they also, just because it's out there and it's easier to obtain doesn't mean it's necessarily in the public eye. And one of my roles and one of my jobs is to help folks learn how they can and can't market their services to, prospective patients, users, folks that would really benefit from a virtual offering.
Interesting. So tell us a little bit more about what specifically there's new bulletin about HIPAA and the use of cookies and things of that nature. What is the government now saying relative to what is compliant relative to that?
Yeah, so December 1st, 2022, OCR, the Office of Civil Rights under the Department of Health and Human Services, published guidance related to what they call online tracking technologies. For the folks that are in the marketing space and certainly in the advertising space, this is typically what we consider your tracking cookies, your pixels, your web beacons, those types of technologies. And HHS came out and really drew a line in the sand and said, look, this is what our position is going to be in terms of the use of tracking technologies, and this is how we think it should be governed. We can get into the specifics a little bit, but sort of backing up, maybe 6 months to a year prior to December 1st, we really saw this, sort of uptick in media coverage on digital health apps, mobile health apps, and their, sort of collection practices related to their users, prospective patients, and sort of, how they interact with their patients during that onboarding process of, hi, I'm a website browser. Now I'm going to, educate myself as to what your services is offering. So, are offering. So you could think about maybe a mental health company that has a brief quiz or questionnaire on its website. You go onto the website, you work through the workflow, and you sort of take some of that information in, you answer a couple questions. That questionnaire may provide you with some thoughts or some very general analysis. And really what OCR, sort of fast forwarding back to December 1st, was looking to do is to say, we understand that, the digital health era is upon us, and that, these technologies are widely used and sort of, very, very commonplace at the moment. We want to give you some guidance as to when and how we think these technologies fit within HIPAA's privacy rule. And so really what the gist of the OCR's bulletin was that if you're a HIPAA regulated entity, and again, for those that have been following the privacy debate, that is a limited scope of participants. If you are a HIPAA regulated entity, your use of tracking technologies that collect personally identifiable information or protected health information under HIPAA must comply with HIPAA's privacy rule. And so essentially, you have to take the definition of protected health information and understand that already that definition is extremely broad and captures even demographic information. So one of the questions that I get most often is, well, it's just an IP address and it's not tied to healthcare information, right? Nobody takes the IP address and says, oh, well, I know that, this IP address is related to this person's health condition. But the definition of PHI is so broad that it actually does capture IP address in and of itself. And so what this bulletin is basically telling these HIPAA regulated entities is that there is, once that collection of PHI occurs, once you've collected like an IP address or something else that identifies the individual, the HIPAA privacy rule applies. And this is what our position is related to these tracking technologies. And really, it's very broad and sort of goes into some buckets of categories. And we can get into a little bit of some of those buckets. But generally, it's really three buckets that OCR regulates. It's authenticated web pages, unauthenticated web pages, and mobile apps.
Interesting. So let's pause there for a second. I am a consumer. I'm on a HIPAA regulated website, and that site captures my internet address. But they don't necessarily. I didn't log in yet, right? They don't really know it's me. I'm a guest, right? So is there? How do they? There's no association with an actual person, and there's been no disclosure. Why is that still a regulated PHI information?
Yeah, so it's a great question. I think that, the question kind of hits on some of the surprise that this bulletin caused, which was just how broadly OCR was interpreting the definition of protected health information. And so what OCR's guidance says is that, there are differences based on the type of website that, a HIPAA regulated entity offers. And, they really broke it down based on what part of the website a user is interacting with. But even more generally speaking, in the bulletin, OCR makes this comment that essentially says all such individually identifiable healthcare information that's collected on a HIPAA regulated entity's website or mobile app is generally PHI, even if that individual doesn't have an existing relationship with the HIPAA regulated entity that's collected that information. So, to answer your question, OCR's position here is that generally speaking, if you're a HIPAA regulated entity and you collect information, even from somebody who has, maybe mistakenly landed on your webpage, OCR's position is that could be PHI. And really the circumstances will dictate, whether or not that is PHI. And so really there's, the rest of the bulletin focuses on, how to address whether or not the data that is being collected by that website is protected health information.
Yeah, I mean, that creates a whole domino effect relative to if I was the covered entity potentially, or even the BA. What do I do with that information? And do I have the right in the context of looking into who this patient was, right? And now I have PHI information, right? It's just like an electronic health record system, right? I'm a nurse on the 11th floor. There's a patient on the first floor. I have no relationship with that patient, and therefore I should not have access to that patient information. Right? That's a breach in and of itself, even though you're an entity or a member of that covered entity. Right? So now I have this PHI information. I technically can't. What you're saying is I can't do anything with it because now because if I did anything with it, it ultimately potentially leads me to have a breach in the security of that data.
Yeah,
Am I reading that correctly?
no, I think that's right. I think one of the, and I'm not sure this is an intended consequence, but even in that situation where maybe that general statement of all such identifiable information collected by a HIPAA regulated entity, generally PHI, you create sort of a large field of potential impacted individuals if that information is shared with a third party, like even leaving aside sharing information for marketing purposes, or to attract an individual back to your website to really take a second look at your services. Any type of disclosure, analytics, or sort of understanding how users are interacting with your website, now all must be done in compliance with the privacy rules. So those
Right.
third-party vendors should have business associate agreements in place with the entity that is HIPAA regulated and operating the website.
So give us some best practices, right? We have this new bulletin. It creates this interpretation, so everybody's got a shift in their headsets relative to how do they now handle this data, right? So give us, if you don't mind, some what would be the top three recommendations that you would offer to say, hey, to keep yourself out of trouble, if you will, in layman's terms. Um, what would you recommend these HIPAA regulated entities do?
Yeah, I think the first thing is to really dig deep, understand, your workflow. And really that means understanding your workflow from a holistic perspective as well as a granular perspective. And when I say holistic, I mean, what is your offering? What digital health, sort of what area of the industry are you working in? Are you a very specific, do you have a very specific specialty, i.e., behavioral health, substance use disorders, diabetes? If you're very condition specific, then as you will sort of understand the guidance from OCR, that makes a difference in terms of whether or not the information that you're collecting is considered PHI. Conversely, if you are more of a general practice, or you have multiple offerings, maybe just not a clinical service offering that's regulated under HIPAA, you may have a little bit more freedom in terms of how you collect data, how you sort of understand and sort of disclose that data, and how you identify and categorize that data. From a granular perspective, the workflows and user experiences are extremely complicated. There's data collection that's occurring almost at every point in that user experience. And so really understanding what data is being collected, who it's being shared with, almost completing a data map is table stakes at this point, because one of the questions most people are asking is, who are you sharing my data with? And you have to be able to answer that question, whether you're regulated under HIPAA or the FTC's, under the FTC's oversight. You have to be able to share who you've disclosed data to, and really, during this exercise, that's extremely important from the perspective of user transparency, but in the HIPAA context, also from being able to comply with the privacy rule. Go ahead.
Yeah, I'm sorry. No, I was just gonna. It just draws down to the earlier question, right? I have this data now, and you used the right phrase. This data map. It sounds like I can't even construct a data map, because constructing a data map would require me to go get more PHI information that I can associate with this patient. And because I don't have really, I'm the nurse on the 11th floor, as I was using earlier. I have no right to look at that patient's information So what right do I have to build that data map when I start small with a cookie and have to build it out? And I would imagine that information would have to be stored in a protective place, right? It has to be encrypted at rest once it's collected. Am I missing something here?
No, I think that's right. Once it's been determined that the information being collected is protected health information, then the other, side of HIPAA applies. You must comply with the security rules. So, your data should be protected in line with the security rules requirements, and the best practices obviously will apply. Encryption at rest and transit, and then as well as during you know during your uses and disclosures of that data, you have to ensure that you're obtaining the right either contractual arrangement through with a third party through a business associate agreement, or you have an explicit authorization from the individual in order to allow you to share that information. And so really, I think that going back to sort of, you asked what the big three things, the second sort of bucket of information there is, what does the guidance say? How does the guidance apply to that data map, right? And really what OCR has said, from just taking it from the website perspective, is that OCR looks at web pages and breaks them down into two categories: unauthenticated and authenticated. And you can take that to mean, are you logged in or are you not logged in, right?
Right.
If you're not logged in, OCR has provided some examples as to when the information that you collect could be considered PHI. So this goes back to sort of that first big picture, which is, what's your service offering? OCR, one of the examples that OCR provides is, if you have a condition-specific service offering, diabetes, pregnancy, if your service offering is so specific, then most of the information you're collecting is going to be considered PHI, right? That is OCR's position, because it's basically saying, look, you've collected an IP address, and now you are sharing this information with a third party for, let's just say, for marketing purposes. Well, that third party may understand that your service offering is a diabetes treatment digital health, clinical service offering, and the IP address is now tied to your service offering. So ultimately, what ends up happening is that third party now understands this IP address, which these days most of these third party vendors can pinpoint location and can pinpoint identification through IP address, are now able to discern that this person is interested in a diabetic treatment offering. And so one of the big takeaways is really, like I said, understanding how this guidance applies to you, and really, are you logged in or are you not logged in? And then if you're not logged in, does one of these exceptions that HIPAA's sort of laid out apply? And really, what we see is that a lot of the digital health community has gone to very, condition specific, targeted offerings. And one of the major drawbacks of that condition specific targeted offering is that it falls right in line with OCR's guidance that any information collected by that condition-specific offering is generally considered PHI. And so, again, immediately once you've collected that information, HIPAA's privacy and security rule are applicable.
Wow. So I interrupted you earlier. We were going through the 3-point recommendation, and you had finished point number 1. Can you continue on with points number 2 and 3?
Yeah, so number 2, I think we sort of alluded to already, which was understand how the guidance applies to your offering, and are you operating on a authenticated web page or an unauthenticated web page? And so as we sort of said earlier, are you logged in or are you not logged in? OCR's position, really from the perspective of a authenticated web page, or once the user is logged in, is that anything that's happening sort of beyond that login point, that information is almost certainly PHI. You have the user's login credentials. You probably have a little bit of information about the individual. Maybe you store medical records or treatment records based on services that individual has obtained. OCR's position is those are medical, that is protected health information at this point. And so any uses and disclosures after, uh, based on any information collected after the user's logged in, that must be done in compliance with the privacy rule and the security rule. So business associate agreements have to be in place, or you have to have an individual's authorization in order to disclose that information. The sort of second big bucket that OCR created was this unauthenticated web page. But as we kind of alluded to earlier, there's some exceptions there, and OCR says even if you're on an unauthenticated web page and the user's not logged in, if you have a condition-specific offering, and I think OCR uses the examples of pregnancy or miscarriage, then the information you are collecting could be considered PHI. The second sort of exception to the authenticated web page position is, are you offering like a calendaring function so that when the user logs in, they can tell you why are you here? They can schedule an appointment with a physician or a clinician and give a little bit of background information. OCR says if you're using a calendaring option that gives individuals the ability to share some of the information that will ultimately be used in their appointment, that information is considered PHI as well.
Wow. Okay. Some very interesting context to this bulletin. So if I'm on a website and I'm looking at providing some access to different lab tests or things of that nature, maybe it is a pregnancy test or a women's health test or something of that nature. Just the fact that they're not logged in but they clicked on it sounds like that's applicable to. Now I have a web address and a cookie and a click on a clinical category that I need to protect that information, even though they hadn't logged in. Just trying to draw some analogies and examples relative to how this applies.
No, I think that's right. I think that any digital health website that is, and this is, to be clear, this is really specific to HIPAA regulated entities here. They have to be sort of mindful of the guidance and really, as we said, when we were pointing out what the big topics to look out for are, really where the guidance puts their digital health offering. And it's an analysis, it's case by case. I wish we could draw, sort of a big line in the sand and say, here's PHI, here's not, here's where PHI does not exist. But what you find if you sort of work in the space is that it is extremely specific to each and every telehealth company, virtual health companies, user experience and workflow, and how they treat the onboarding of their prospective customers. And so, yeah, your examples are everyday examples that many of our clients face, and they've sort of been trying to understand where they land in terms of this guidance, and it is sort of it's not easy to sort of discern, and in some cases it's hard to sort of really discuss, right? I mean, the idea that someone may have mistakenly landed on a web page and now their information is PHI is kind of mind-blowing.
Yeah, no, I absolutely agree. It definitely requires a shift in thinking relative to how we handle this electronic engagement tool called the web, and/or an app for that matter. So we have a couple minutes left. I think we have 2 minutes left. So tell us what else, if you had a crystal ball. I mean, this is regulatory, so obviously it's something that we all have to be close with. But anything else on Capitol Hill in the context of privacy and security we should be watching for?
Yeah, obviously, when you think about privacy and sort of how, the country as a whole views privacy rights, we have very different opinions, and we also have very, the understanding that once you get into the world of collecting healthcare information, you're not only grappling with the federal regime of, HIPAA and, the FTC's oversight you're also grappling with 50 different state laws and how those state laws sort of interact with HIPAA and whether or not they create uh, rights that would extend past HIPAA and really really make it these laws and these differences really make it challenging for companies to operate, especially in a companies that are looking to operate with a 50 state footprint. And so one of the the things that we sort of hear rumblings about, and maybe more than rumblings at this point, is the federal privacy legislation, which would hopefully supersede state laws in terms of how health information should be treated, how it should be handled, and really how organizations and individuals should expect data to be managed, right? Because not only do we want to protect privacy rights and individual rights, we also want to educate organizations and companies out there. This is how you should interact with data. This is how you should, inform your users how their data will be used. A single cohesive law that really addresses sort of both ends and both outlooks goes a long way into making this area easier to understand, easier to manage, and then ultimately easier to deploy.
Interesting. So we're going to have to stop it there, Aaron. Really do appreciate your expert guidance. Foley, and I have no relation, but I have to say Foley always does it right, given my last name is Foley. But nonetheless, Foley Laudner, you can go to Foley.com. You can also find Aaron on LinkedIn. I'm going to spell your last name so they can find it. His profile is Aaron, Aaron. His last name is spelled Maguregui. Aaron, I appreciate your time and your expertise and sharing it with the audience. Hopefully we'll have you on soon and in the future.
Thanks, Tom. Really appreciate it.
I want to thank the show sponsors, HP. HP Engage Long Lifecycle Products provides the stability, safety, and security you need, plus flexibility and performance designed for today and tomorrow. As well, GenieMD, providing a modular, scalable, and customizable virtual care platform and clinical services to help providers extend care into the home, increasing access and quality while driving new revenue opportunities. If you missed part of today's episode, you can tune in at the same time, 11 a.m. or 7 p.m. Eastern, throughout the week, and be sure to check out the program page on healthcarenowradio.com. And remember, connect or follow me on LinkedIn, Twitter at FoleyTom, and follow the show's hashtag, The Virtual Shift. I'm Tom Foley. Until the next shift.